Hi, my name's Dr. Sandra Hardee, and I'm the Medical Director of Occupational Health Services for Prisma Health. We did a video a couple of months ago introducing myself and my team to y'all, and we're happy to present another video. This one's going to be on a common topic that we discuss with our clients, and it's about doing drug screening for employees in the workplace. This is a topic that comes up commonly. Drug screens can be done for a number of reasons. They can be done as a pre-employment drug screen. They can be done for someone as a post-accident. It can be done for random or suspicious causes. It can be done for a return to duty if someone's been out of work for a period of time. So there's a lot of reasons that these are done in our offices. So we do perform these drug screens at all 4 of our locations throughout the state. But in addition, if you're a large company and you need us to come on site and do random screenings, we can also do that. That is a service that we offer. So don't forget that, because that is something that we do actually for quite a few of our clients. So I'm going to go a little risky here, and I'm going to start punching some buttons. I'm going to bring up some slides that I am very happy to say that I stole with permission from Dr. Smithwick, who is one of our board-certified occupational medicine physicians here in the upstate. So we're going to talk about employee drug testing, as I mentioned. Myself, I'm a medical review officer, which is what the MRO stands for, and so is Dr. Smithwick. So we are the 2 physicians on staff who, for any drug screenings going through our offices, we're the ones who will look at and evaluate any positives or what we call non-negatives. So just so that you know, when we get these results, we evaluate, make sure that everything was done properly in the chain of custody with the results, and then we reach out to the donor if that's appropriate. Sometimes the donor has not let our staff members know that they're taking a particular medicine, and sometimes they just simply need to provide us a prescription for a medicine that they're taking. So we have a little bit of investigation to do, is a nice way to put it, that we're trying to seek the donor, find out what may be causing the non-negative result, and then determine how appropriate that is. I will say that we're very sensitive to the fact that some medicines are prescribed for patients that may impact their ability to work safely. So if it is a prescription that may cause drowsiness, for example, we will typically write that the patient is prescribed a medication that may be sedating and that we recommend that they take it at least 8 hours prior to their shift. That reiterates to the donor and also lets the company know that that may be an issue for that individual. An MRO, just a quick slide, there are 2 agencies in the U.S. that you can be certified to be an MRO. It takes a special training and certification. We do have to recertify every 5 years. So drug screening became much more formal in the early 1990s due to the Department of Transportation, when it was looked at by the government, and I'm going to circle these here, in the trucking industry, airlines, any kind of public transportation, commercial driving licenses required that these individuals have sporadic randomized drug screens. And there is a specific federal DOT chain of custody that we use for these individuals. So most companies, even if they don't have drivers that drive large 18-wheelers, but they want to do a very formal testing, they will follow the same guidelines as the DOT procedures. And that's what most of our clients do, because they want to know that it's a very secure, HIPAA compliant process that we're following, and that we're getting the most accurate results. So why do we do this? Well, there are a lot of drugs that are being used by individuals, some that are prescribed, some that are illicit. You can see by this slide, marijuana by far is the most used drug that is found among individuals. Opioids are the next. So they account for the largest volume that we see. This is data from 2018. The new data came out from 2020, and it mirrors this, just the volumes are a little bit higher. I'm going to speak a little bit later about marijuana. One of the emphasis I do want to talk to during this presentation is there's a lot of confusion about marijuana testing, the use of CBD products in the workplace, and what that looks like in the future. So I will address some of those issues. First thing we talk about is a specimen collection. So you could do an all-day, 8-hour presentation on how to do specimen collection. But we do have it's a very strict process that is worked through by the statute that our teams are trained on every year. We have certified occupational health nurses who train our staff and team members on the correct process, and they have to go under annual training and their competencies to make sure that they're doing it correctly. So it is a fairly tedious, it's a very meticulous process when we collect these specimens. The issue with a urine drug screen is if you work in HR, you may know there can be issues with that. The client, the employee may appear and have a shy bladder, not be able to provide a specimen. There are times where they may try to use a specimen that they brought into the clinic. So there can be some challenges there. We follow strict guidelines with that. If we have an issue with a collection, we notify the employer that there's an issue and that that the individual will be there longer for testing. So if you see on this second bullet point, one of the things that will be coming hopefully in the next year or two is that the agencies are looking at switching to oral swabs. And that will be a big advantage, obviously, because the collection issues all go away. We don't have to worry about shy bladders. You can always get a specimen. It can't be adulterated. All those collection issues will go out the window. So we're looking forward to that. I'll go ahead and share with you a little bit I know about the oral testing so far is there will be rapid tests, just like we have rapid urine tests. There will be more sensitive and specific testing that we can send out from an oral swab, just like we do with a urine collection as well. Cost should be about the same, but I think these are going to be very, very positive in the workplace because of the challenges that sometimes can come with collection. So what do we test when you send an employee? So if you're in HR, you may be familiar with these, but there's typically 2 panels that are the most common. There's a 5-panel screen that you can see here with the common drugs, and then there's a 10-panel, which is a little more broad in that it contains some other medications that are not as common that you may see on the 5-panel. There are the ability to do the initial screenings, these e-screens or Insta-kits or whatever they're called in different locations, and they're very specific. So those are about 98% specific for drugs. So some companies, they are very comfortable with just using the Insta-kits, the on-site kits that we offer. Other companies use the Insta-kits, and only if it's a positive or what we call a non-negative, then we send it out to a lab like Quest or LabCorp for further testing. Or some companies don't do the Insta-kits at all. They just collect the urine. We send it out to a confirmatory lab for the results. I will say that the labs that we do send out, they are highly sensitive. So they use a method that is much different than the immunoassay on the rapid test. They use, this says down here, the GC/MC, that's gas chromatography and mass spectrography. It is a very specific and sensitive way to test any kind of urine sample for the drug. So to give you an example, this will measure in parts per billion of a drug. Again, Dr. Smithwick has loaned me this awesome slide. So a parts per billion level is like detecting one drop of a liquid in a loaded tank truck. So you can imagine that's how sensitive it is. So these tests are very specific, very sensitive in their findings. going to switch a little bit and talk about marijuana because this is probably the question, the drug that we have the most questions about. First of all, let me talk about the testing. And the marijuana is the most commonly thing that we see come back positive on a drug test. There really is no legitimate medical explanation for a positive cannabis test except for any compound that would contain THC. So there is a seizure disorder that's a rare treatment is this medication. Never seen it written, but it won't even cause a positive screen. So some people will throw out, or a donor will throw out this drug, and it even won't cause a positive. So there's really not, aside from using, if you were prescribed for a medical reason, marijuana, which is not legal in South Carolina, but in other states it is, there's really no, quote, legitimate reason for a positive test. However, in 2022, that's changed. Over the last year or two, we've all seen the growth of the industry of CBD or cannabinol products. They can be from oils to tablets to lotions, they're in edibles, they're everywhere. So it is possible that if an employee is using a CBD product, they can test positive for THC. The problem is we can't tell. We can't tell by that test if that positive THC result is from marijuana use or a CBD product. And I'm going to take a couple of minutes to explain the reason why. So the CBD industry, they use products from a hemp plant, which is very similar to a marijuana plant. The only difference is in a hemp plant, there has to be less than 0.3% active THC in that plant. That's the psychoactive part that causes the traditional high you think of marijuana. So hemp plants only can contain a tiny amount of THC, less than 0.3%, whereas a marijuana plant contains much higher. But these are products that are not regulated. They're because of the way that they are able to be packaged under the Federal Dietary Supplement Act. There's no regulation. So we really don't know what's in these CBD products. So when I have a donor with a positive test for THC, I will inquire about CBD products. If they state they use them, I will make a note of that. I advise the donor to please stop using that CBD product, that it could be the cause for this positive screen. And if HR, the company that they're interfacing with, has questions about it, I just encourage them to be positive about, to be transparent and be honest about what products they're using. That then translates to a bigger conversation is what are companies doing about this? So a lot of companies now, honestly, with marijuana being being legal in so many states, they're not testing for THC. That's one way they're dealing with it. Other states, particularly in the Northeast now, are having new laws signed into place that makes it illegal to fire someone with a positive THC drug test. But there are caveats to that. It depends on the type of job that they have. If they work in healthcare or they work in a job that could possibly be a public safety issue, that would not be enforced, that they would be able to be fired in that instance. So there's a lot of gray there in terms of THC and testing. What I'm finding is most companies are now sort of transitioning to, if they do test for it, it's only done when there's cause or suspicion, or if they see someone using a marijuana product on campus. Otherwise, they may not test for it, or they don't really consider it in their hiring or firing of an employee. But again, it depends on the position that employee is being hired for. So there's a lot of gray there. And I'm glad I'm not in your position because that can get challenging at times, I'm sure, for y'all. But if you have questions about any of the drug testing, how we view it, how we come up with our recommendations, or how we result out to you, please contact us. There are some situations where it can get a little tricky with these tests. And certainly we want to help and advise you the best we can on how to interpret the results. And we're happy to do that for you. Dr. Smithwick and I are happy to answer any questions about that for you. I think I have a couple more slides. One thing I think that's kind of interesting that we don't think about is a lot of people sort of think, if someone uses, say, for instance, cocaine or a hydrocodone or oxycodone product, that it's going to be in their system for a long period of time. And that's really not true. Typically, most of these medications can be detected, or drugs can be detected for only a couple of days. So you'll see on this slide heroin, cocaine, hydro, and oxycodone, Xanax. These are, 1 to 2 to 3 days. The outlier here is THC. It is stored in fat cells, so it can stay in your system for a long time. So if someone uses marijuana one time, it can be seen on a drug screen up to a week later. If they use it weekly, it can be seen up to 2 to 3 weeks later. If they use it every day, it can be seen up to a month later. So it really depends on their usage and how often they're using it. But I do think it's sort of interesting. We tend to forget that after a couple of days, if they've used one of these medications, it will not be detected. But again, if you ever have questions about that, we're happy to go through that process with you. So I want to make a reminder. I did steal these slides from Dr. Smithwick, but we are doing roundtables in both the upstate and the Midlands for any of our companies or that are current clients or companies considering being a client of ours. We're doing a host of topics from pre-employment physicals to topics like drug screening, and we will be doing those, like I said, throughout the year, about every quarter. So your business health solutions team members should be reaching out to you. That would be Pam Wessel, Ashley Creech, or Scott Dills. They are the ones that help communicate with you. Some of these will be communicating with you, these roundtables coming up. So if one is in your area, we typically do them in the morning. It's very casual. We'll provide a light breakfast for you. It's great to meet other community leaders at other companies in your area and talk to them about what they're doing in their environment. We've had several so far, and they've been very well attended, and everyone, I think, had a really good time and sharing some ideas. So be on the lookout for those. Also, we'll continue these videos. We'll be doing our blogs, as you've seen on our webpage as well, that comes out from our business relations team. So please, I hope you enjoy these videos. I hope they're helpful. If there are specific topics you would like to cover, we're more than willing to do that. You just need to let us know. So I appreciate your time and have a great day. Thank you.